overdoses every week. We're seeing people in desperation.
Harm reduction workers have been on the front lines of what's been deemed a crisis for years now, saying governments need to step in to provide more supports and fast.
We are constantly seeing people fall through the cracks, and it's always reactive in terms of them saying, hey, there are bad drugs out there. A lot of people died last week. There isn't necessarily the infrastructure or the testing capacity for us to find out in real time that these things are happening.
Recently, Toronto Public Health issued a warning to the public stating 10 people had died from overdoses over a 5-day period.
I mean, we see those notifications all the time.
At the root of the opioid overdose crisis is a contaminated and unpredictable drug supply market, according to Toronto's drug checking service launched back in 2019.
That allows people to make more informed drug use decisions themselves. About a quarter of the people who access the service have never actually used harm reduction services before. So in a way, drug checking is a bit of a gateway to accessing harm reduction services.
But funding is set to expire by the end of the year. The group unsure what will happen next, but hopes the province will support the service.
We're the only drug checking service in the province currently.
And the public data collected isn't only used by drug users, but researchers, clinicians, and policymakers across Canada.
So there's sort of a sliding scale of people who use our information and that who will no longer have access to exactly what is in the unregulated drug supply if our service was not to receive sustainability funding.
Over 7,000 samples have been checked. About half is expected to be fentanyl.
Only 5% of the fentanyl substances we check only contain fentanyl, meaning that 95% of the time the contents of expected fentanyl samples don't align with what the service user expected.
The bottom line, the drug supply is harming and killing people.
We have policy responses available to us to address this issue, and they're not being taken up quickly enough by our policymakers.
Ontario's Ministry of Health says it's currently funding 17 consumption and treatment services in 10 communities, including 6 in Toronto. But frontline workers say harm reduction support, such as drug checking services and supervised consumption sites, need to be scaled up, made permanent, and accessible to more people.
A permanent, robust, well-funded, safe supply program will allow people the stability and the access they need to begin to take those next steps.
For City News, I'm Faiza Amin.